and I'm the director of the Federal Programs Unit with oversight for our waiver amendments. And most recently, we did receive approval for our valued-based payment amendments and the addition of 9 incentives that were effective January 1st of 2023. So today's webinar is over the value-based payment provider training for data collection for those 9 incentives. So we have today's webinar, and then we will have a repeat webinar with the same information on January 10th, Tuesday, January 10th. So you are welcome to join both if you want to, or join one. And then, as Kat mentioned, we do have, this will be posted for your reference, because these slides will be a good reference when you start going in and entering data for the 9 incentives into REDCap. So today I'll be presenting, as well as Kim Stocks, Heike Johns, Wanda Crocker, Dwayne Shumate, and Kathleen Depler from the department or in the division. Go ahead and get started. In today's webinar, we'll have an intro to REDCap. We'll present how to request access to REDCap, some navigation and tips within REDCap, then we'll show you the incentive data collection process for each of the 9 incentives in REDCap. And then we're also going to do, as we go through each of the 9 incentives, we'll provide an overview of the draft provider contract language that will be coming out for the incentives to be added to provider contracts. And then the data collection timeline, reviewing when the portal or when REDCap will open up, how much time you have to enter data that you've collected or you need to enter for an incentive, and then when it closes. And also some resources that are available to everybody out on our value-based webpage. So introducing REDCap. REDCap is a system that is an online tool to collect data. It is a secure website that can be accessed via internet, including tablets and smartphones. DD is utilizing the REDCap platform to capture requests for incentive payments, data collection, and attestation of the data collected for the incentives. REDCap, to get access to REDCap, you'll need to request that through a link that we've provided here on the PowerPoint, or you can also use the QR code that is shown there to request access. Once you go into that page, there's a form that the user will need to complete, entering their contact information, their organization information, your manager information, why you are requesting access to REDCap for our incentives, and then lastly, what incentives are you asking for access to? Some organizations may be requesting access for all 9, or you may be just asking for a couple or just one, depending on which incentives the user will be entering data for. So to navigate REDCap, what I'm going to do first is go through the steps. It's pretty easy to navigate if you follow these steps that are in the PowerPoint. I will warn you, there is some, when we will show it to you, we'll show you REDCap today. There's a lot going on, and it can be confusing at first just when you go in, but if you follow these steps that we've outlined in the presentation, you can easily get to the parts of REDCap that you need as a user for these incentives to enter your data. So the first thing you will do after you have access to REDCap, you will log into the REDCap website using this REDCap website address, and then you'll click on My Projects. And based on what you have requested access for and which incentives you will be entering data for, you will select the incentive that out of the list shown on your screen here. This this list of incentives that you will see will be based on your user access. If you have requested access only to the tiered supports incentive, that will be the only one that shows up. This screenshot that you see on your screen right now shows all of the incentives listed. Once you've clicked on your incentive that you're going to enter data into, you will need to click Add and Edit Records. This will be on the left-hand side of your screen. So you'll add a record, which makes sense because you're adding new data. You'll click on Add New Record. And then you'll select the reporting time period. So this section, you may see several different options depending on which incentive you're entering data for a couple reasons. Some incentives are based on quarterly, some incentives are twice a year, some are annually, some are monthly. So depending on what incentive you're entering data on will depend on what you see on your screen. For instance, if the first screenshot shows what you should select if you have a 6-month or twice a year incentive, you'll pick which time period that you're reporting on or entering data in for. The first incentive or data period we have shown on in the screenshot is for fiscal year 23, from July 1st of 2022 through December 31st of 2022. You would click on the little button there, and it would take you into the next number 6, the area where you will actually enter your data information, data entry, and your attestation to the data that you've entered. For some incentives, there are several steps to entering your data, and that's where you see on your screen over here where there is provider information, but there's also DSP information, provider attestation, and lastly, DMH review. So each of the incentives could be slightly different depending on which incentive you're entering data for. For this one over here, you would have to enter your provider information first, and once you've completed that, you move on to your DSP information, complete that, and then lastly complete your provider attestation. The DMH review portion for each of the incentives is only for DMH use. That is where the DMH reviewer will go in and review the data that provider has submitted and just make a determination if the provider and the data meets the criteria for the incentive. So in this section number 5, you may see different time periods depending on the incentives. As I mentioned, some are monthly, some are quarterly, annually. And you may see a difference in what is listed under the data collection instrument. It may be as simple as just one reporting item, or there may be several reporting items that you have to complete. The last step after you've selected the instrument that you're going into is to complete the provider information, number 6, enter the data, and then complete the attestation. These steps that I've gone through 1 through 6 are primarily the same for every incentive. Once you get in and when you complete number 6 is where you may have some variances of how much information you have to enter for the incentive. If, for instance, there are several incentives such as EVV, the Hearst incentive, and the NCI staff stability survey that is very limited to what you have to enter. When you go into the system, you're going to select EVV, go in, request the reporting period, and then enter your provider information, attest to that, and then you're complete, you're finished. You're just attesting or requesting the incentive because the data for EVV, Hearst, and the staff stability is outside of REDCap. that data is coming in from other sources like this Relias or Intellectability or this EVV aggregator. So those are more incentives where you just go in and request incentive, attest that the information you've entered into the systems, the outside systems is correct. There are three additional incentives, the DSP apprenticeship, the DSP training incentive, and the remote supports incentive that have more information that you have to enter. It's kind of more than the EVV incentive and the three minimal ones, but less than our more heavy data collecting incentives. So those are kind of in the middle. You have some information you have to enter based on other systems that we are using to collect data. And then the last two are our reporting, tiered supports reporting and implementation, level of implementation, and our employment reportings. Those three incentives are very much heavy on the data that you actually enter into REDCap. That's where the REDCap is your data collection source or your data collection tool. And those are, you're actually entering all the data for those incentives that you have to report on, pay for reporting, and you have to do the other steps as far as provider information and attestation. So that's just kind of some variance on each of those on our how you use REDCap. Every incentive uses REDCap. It's just, it may vary depending on how much you use REDCap to collect data or enter data. I'm going to show you just quickly what this looks like in REDCap Live. Here's where you enter your username and your password. So if we follow the steps on the presentation that I went through, you would go to My Projects. It actually brought it up to here right for me, probably because I was here previously. Normally you would come in and you have your home page here. As I mentioned, there's a lot of information here. It can be a little distracting, but if you follow the steps in the PowerPoint, it will get you where you need to be. So it's My Projects. And then in this case, I only have two listed here. So I would go into the EVV. And the next step was to go over to add and edit records. Again, as I mentioned, there is a lot of data over here. You can do a lot of, there's calendars, there's a lot of different options over here, but you want to go into your add, edit records. It gives you a little bit of a synopsis of what the incentive is about. The next step is said to add a record. And this is where it brings you into where you would actually pick, the next step was step number 5, where you pick your reporting period. I'm going to pick fiscal year, the first reporting period, July 1st through December 31st of 22nd. And then you start into the next section, which each of our incentives has, where you have to fill out your provider information, put in your provider number, your name and contact information, and provider attestation information. There are several ways to save a form. A lot of save buttons here. Just pick which one makes sense to you. If save and exit makes sense because you want to leave, if you want to save and go to the next form, just whatever makes sense. You can also cancel. It'll tell you that it'll give you a warning. Do you really want to cancel? You'll also be adding your signature with the attestation, and every incentive has this provider attestation part. And lastly, the last thing you'll need to do is you'll need to complete the form. There are three statuses in the form. Incomplete, if you're still adding data and you want to come back to it, you can use this in-between status, this unverified. It can be used for if you still need to come back and do the attestation, or someone else needs to do the attestation, or maybe somebody else in your organization wants to do an overview before you submit it for payment. You can use unverified. And lastly is complete. That's the status for when you've got everything completed in here in your form. All your data elements have been entered. You're ready to submit it to the department for payment or for consideration for incentive, for the incentive. The complete status is what it needs to be in for it to be considered ready for the DMH to review it for the incentive. So that is a quick overview of what it looks like in the system in REDCap. And then I'm just going to quickly go over how to edit records. It's pretty much very similar to what you saw before. You're going to click the Add Edit Record. Instead of adding a new record, though, you will be able to select the record from the drop-down box. And then you'll click on, again, you'll click on the item that you want to edit. So it could be your reporting that you want to edit. At this point, it's red because I haven't completed it. A couple of tips for REDCap. Edge and Chrome are the preferred browsers for REDCap. We've provided the links to training and tutorials for REDCap. And lastly, the form status. This is just a kind of overview of the form status. If this is just for your reference, incomplete, your data entry is incomplete, so you still are entering data. You can leave it, you can save it and leave and come back to that same form and note that it's incomplete. It's unverified. Your attestation isn't complete. These are based on what you as the user select. So if you keep it incomplete the whole time and go straight to complete, that's fine. And then lastly, the complete is the one that's submitted to DMH. And there is a warning within REDCap that says important records must be placed in complete status for submission to DMH record reviewers. So the unverified is kind of just a middle status that can be used if your organization uses that for maybe a double check if someone else has to review a record. So that's the basic overview of REDCap and entering the data into REDCap for the incentives. Each of the incentives look fairly similar to what I showed you with some variances based on the incentives, how much information is actually collected in REDCap. And now next we're going to go into each of the incentives. I'm going to start with EVV because that's the one that I'm kind of the lead of for the incentives. If you're familiar with the incentive, it's for agency, personal, or PA services. The provider enters a request for the incentive into REDCap. No EVV data is actually entered into REDCap by the provider for the incentive. So you enter your request and do your attestation within the system for EVV, and then the division will do a comparison of paid MoHealthNet claims in the MoHealthNet system and verified EVV records in the aggregator system to determine if the 80% is met for matching records. So the systems that the incentive uses is REDCap, the EVV aggregator, and the MoHealthNet claims. And this is just a screenshot of what I showed you already of the provider information that you will be filling out. And then lastly, I wanted to quickly go over the contract information established. So each of the incentives will have contract language added to the provider contracts to provide language around the incentives and the payments. For EVV, you'll see that it's a defined performance measures are met. For personal assistants, they'll be paid 1% over the total amount of their personal assistant claims. It's a biannual payment, and this chart next shows the actual performance item related to the Cures Act, the performance standard related to EVV records, the definition of every PA visit shall have a successfully transmitted record, and then specifies the benchmark, biannual benchmark, how it's calculated, the EVV incentive is calculated. And then lastly, you must need 80% or greater to get the payment. Less than 80% will equal zero payment. And that's the information, and this is draft language for the contract. And now I'm going to turn it over to our next incentive, and that is Kim, who will be going over our NCI staff stability incentive.
Thank you, Emily. Good morning, everyone. For the NCI staff stability, and just a quick reminder to everyone, NCI recently changed their reference to the staff stability survey to the state of the workforce survey. So you may start seeing that reference. They will continue to also use reference to staff stability during this transition period. So just for information regarding that. The process for the staff stability survey has not changed in regards to the provider agency entering the information in directly to the NCI system. As Emily mentioned earlier, some of the incentives will be relying on the data from various systems, and this particular incentive is one of those examples. Who the NCI staff stability incentive applies to is current DMHDD contracted 1915C HCBS waiver service providers of residential in-home and non-residential services. The annual NCI staff stability survey is completed, as I mentioned, in the NCI system, and that will continue. The data listing of contracted service providers who've completed the annual survey will then be provided to HSRI, Human Services for Research Institute, or NCI. And then our project lead, Caitlin Bartley for NCI for the division, will be looking at that information and reviewing and doing a cross analysis once the surveys are completed in the NCI system. They will be processed by the division for an annual payment. And upon completion of the agency NCI staff stability survey, that is where you'll go into REDCap as a provider once you've gone into the NCI system and you completed the survey information as in previous years. We hope to also see an increase in number of providers participating. So I want to also remind everyone, if you're new to this process and you're interested for the first time in completing the annual NCI staff stability survey, Caitlin is working on finalizing a training that will be posted on the division's website that will walk through and demonstrate some of the information that is expected to be entered in to complete the survey. And that was based upon feedback from our provider community, which we really appreciate that feedback. So stay tuned and look for the email blast from the division in regards to that training and support to everyone who will be entering survey information in this year. So upon completion of the survey information, this is a screenshot of what you'll be asked to complete and enter into the REDCap system. As Emily previously mentioned, it's very limited information in regards to the NCI staff stability incentive because, again, you're already providing the necessary survey completion in the NCI system. So you can see here quickly, you'll just be entering in your provider name, your provider Medicaid number, your contact information, that would be for whomever is directly entering the information in, and then your attestation. And then we'll go back and do the verification. As I mentioned, Caitlin will be doing the cross-reference through the information provided by NCI. Next slide, please. And again, this is the draft contract language that's currently in there. It speaks to the payment for each agency that completes successfully the NCI staff stability survey in the NCI system, and that will be a one-time payment of $2,000. And again, that will be on an annual basis. We also identify the services that apply. So basically, if you're applying, you're able to complete the survey if you have direct support professionals working to provide the service, the waivered service, the HCBS waivered service. And as a reminder, the survey must be successfully submitted by April 30th to be eligible for the payment to be processed. This is also the graphic that Emily had up in relation to EVB. Quickly shows you the performance standard, the definition, the annual benchmark, compliance, and then the payment. I'm also sharing information in regards to another incentive, which is the HRST, the health risk screening tool. As previously with the NCI and EBB, first, the actual health risk screening tool is completed in the Missouri Intellectability System. It's an electronic screening tool that's completed, and so the division will be able to directly pull information in regards to the completion of individual screens. Who this particular incentive applies to is current DMHDD contracted waiver residential service providers and TCM providers that are serving individuals receiving Division of DD 1915C HCBS waiver services. Again, the actual screen itself is completed electronically in the Intellectability System. That data can be pulled by the provider agency. So when you're getting ready to submit for the quarter, the number of HRST screens that you've successfully initially completed, you can pull a report and have a compilation of that information to support you with ease and direct entry into that information into REDCap. The division also has the ability to pull that information directly to do cross-analysis or referencing as well. Next slide, please. This is a screenshot example of what the incentive screen looks like in REDCap. And again, the actual screen itself is being completed in the Intellectability System. As an agency, what you're going in and doing is entering your provider information, your contact information, and for the applicable quarter that you're requesting payment as an agency, you would be noting that and entering in the number of screens that were completed for that applicable time frame. Next screen. This is again the draft contract language in relation to the HRST incentive. So as a reminder, contractors who provide residential services will be paid $72.20 for each initial health risk screening tool completed prior to the end of state fiscal year 2023 for a Division of Developmental Disabilities waiver eligible individual. And again, this is the provider contract information. So it's specific to that POS contract. Again, it outlines who can qualify. So basically, if an individual is receiving waiver services, then they will need to have an HRST screen completed. That is in alignment with the statewide implementation of the HRST process, which will go into effect May 1st of 2023. But what the incentive is supporting is any agencies that have onboarded during what we're referring to as voluntary process or phase one throughout the fiscal year, state fiscal year 2023. You can initiate the process and onboard and start screening individuals that you provide services and supports to. And again, we will be pulling data, the division will be from the Intellectability System. This is again a chart that references the performance standard definition, compliance standard, and the payment for each screen that is completed. And at this point, I'm going to turn it over to Dwayne Shoemate, who will be speaking to the CDSP registered apprenticeship.
Thank you, Kim. So the Certified Direct Support Professional Registered Apprenticeship is one of the other areas that we are doing VBP payments around. Again, this particular incentive is eligible only for those providers who are formally registered to participate in the Registered Apprenticeship Program. So in order to be registered, a provider would actually need to contact myself or Jay Gibbs, who is our apprenticeship coordinator, to complete the orientation process to become formally registered and approved through the U.S. Department of Labor. So those sites who have done that would be eligible for this particular value-based payment. Again, what would occur is individuals who are participating would be registering apprentices through the RAPIDS database, which is the database that's associated with the Department of Labor, and then uploading information there. Once that's been done, then individuals would be working in the REDCap system. So with the next slide, this is a screenshot of the RAPIDS database within the U.S. Department of Labor's apprenticeship database system. So within this system, what I have highlighted here is when you are looking at a particular apprentice, there is an opportunity where this orange arrow is at to upload documents. So a participating employer partner in the registered apprenticeship program would simply hit that documents button and they would upload progress of the apprenticeships, course completions and work hours. And as we move on to the next slide, within the REDCap database, what we have listed here are the different incentives. So here in the REDCap database, one would select the screen that says Registered Apprenticeship Value-Based Payment Initiative, highlighted again with an orange arrow. So with the next page, once you're inside the REDCap system, the screen will kind of appear here with each of the apprentices listed and indicating whether or not you're needing to simply do an update or do your initial data entry. So again, as Emily discussed earlier, you select the Add Edit Records, and we'll go to the next slide. And this is where you'd be entering in your provider information, very similar to the other initiatives. You simply will be indicating your provider name, the 85 number associated with your provider agency, the contact information, the person who's entering the information, and then selecting save and moving on to the next screen. So within the REDCap database, what the provider agency would need to be entering in to access this payment is they would need to enter in the apprentice's number, which is the number that is associated with the RAPIDS database, apprenticeship database through the Department of Labor. So the apprentice number just simply needs to be entered. There is a question where you enter whether they've completed 1,000 hours of on-the-job training or 2,000 plus hours. You'll indicate whether or not they've completed 75 or the full 158 hours of related instruction in Relias. And then you'll indicate whether or not they've completed the full program and been awarded that credential. After that, you just indicate whether or not the apprentice is a new employee when they started the program. And you'll indicate if they were a previous employee, did they have separation during that rehire time? So each of these questions will simply be answered. You'll hit save. And then from there, the provider attestation will occur where you just enter the name of the person putting the data into the REDCap database, the date that it's being submitted. And then in green there, you'll see add signature. And this is where an electronic signature of the person who's providing the attestation would be completed. All right, so as we go to the next screen, the language for this that's in the contract, again, clarifies who this incentive is eligible and able to be accessed from. Again, this is for people who are participating in the registered apprenticeship program as a provider agency. There are two payments of $1,560 that are available. The first $1,560 is available when someone's completed 50% of the program, and the second $1,560 is available when someone has completed the full program and been awarded the credential. Again, this program and this incentive is applicable to those direct support professionals delivering the services outlined on the bottom of the screen here. As we move to the next page, in the contract, there's also a grid that just kind of summarizes the information that we've just reviewed on the amount of payment, who is eligible for that payment, and when they may be able to access that payment. Okay. And with that, I will pass it on to Heike Johns.
Thanks, Dwayne. So DSP training levels. So information that folks have seen numerous times. With that, you'll see the WHO, any waiver service, non-licensed professional staff delivering contracted HCB services, including, and we have the long list there that you've seen many times before. Please note that there is the intensive therapeutic residential habilitation, which was not there in the very beginning of this. So if you haven't seen that, that is the one that I would ask you to take note of. How the provider will enter the number of DSPs eligible based on tenure and training level completion, and they will be reporting that in REDCap. So again, the REDCap screen, this one outlines what those incentive level payments are. So you'll see that level 1 is payment of 1% over the Medicaid paid applicable service claims when 90% of eligible DSP workforce has completed level 1 DSP training and has 6 months tenure with the same agency. When we look at level 2, once again, we're talking that 1% over the paid applicable service claims. Here's where that first change comes in that you'll note on this slide is we're talking about 50% of the eligible DSP workforce has completed level 2 DSP training and has a minimum of 6 months tenure with the same agency. And then when we get to level 3, you will see that again, that 1% payment and again, 50% of the eligible DSP workforce. And this time we're looking at a minimum of 1 year tenure. So this slide, similar to other things that you've seen, it's the provider information. Included on this slide's provider name, Medicaid number, contact name, phone number, and email. You'll see there's a small note on there that that email will be used for future REDCap correspondence. So it's required, can't slide through without including it. On this slide, I will tell you this will not be the next section that you see when you log in. I mixed it up a little for this presentation. I thought it was important for you to be able to see what the blank template looks like prior to the example for this purpose. The data regarding DSP tenure and training level completions are what's entered into the table. So providers will have collected and compiled that information prior to the entry, and that includes the number of eligible DSPs, their tenure, and the number of hours that each, or training hours that each DSP has completed. It's important to note that you can only enter a staff member one time. So if a staff member meets the number of hours for level 3 training, you do not include them in the counts for level 1 and level 2. If a staff member meets the number of hours for level 2 training, do not include them in the counts for level 1. So then we get to the example, which, as I mentioned, you will see this prior to the point of entry when you actually log in. So in this example, you'll note that column A shows the total number of DSPs in each category. And then when we look at B, C, and D, we're looking at the training levels. And then we have that tenure broke down there on the left side. So when we look to see if a provider is eligible for level 1 payment, we're going to look at column A and the DSPs in the 6 to 12 months, as well as the 12 plus months of tenure for the denominator, which would make that 200. So for the numerator, we're going to look at the total in column B, which is 35, column C, which is 86, and column D, 59, for a total of 185. So you can see that example there. That tells us that 185 DSPs out of 200 met level 1 training requirements. And that's 92.5%, which is more than the 90% requirement. So this provider is eligible for level 1 payment. When we look to see if the provider is eligible for level 2 payment, again, column A, DSPs in the 6 to 12 months and 12 plus months category to make our denominator of 200. And then for the numerator, we're going to look at the total in column C, which is 86, and column D, which is 59, for a total of 150. That gives us 75%. And if you'll remember from an earlier slide, the requirement for level 2 is only 50%. So this provider is eligible for the level 2 payment. And when we take a look at level 3 to see if they're eligible there, we're going to look at column A, this time at the 12 plus months only. So the denominator is 125. And we're only going to look at column D for the total training hour or the total level 3 numbers of 59. So that gives us 47.2%. And since the requirement for this level is 50%, this provider does not meet that level 3 payment point. So following that, you will see there is the provider attestation section, submission date. So again, similar to other pieces that you will see on other incentives. And then we have the draft training levels contract language there. So you'll see that this outlines basically the other information that you have seen in terms of the 1%. Payments are twice a year. One thing I do want to point out, in addition to listing all those services there, you will see underlined that payments of one, or that sentence starts with payments of 1% are awarded for each DSP training level met above the required DSP training. And so I want to be sure that folks note that. And with that, the next slide, I'd like to think that folks, you probably have an idea what I'm saying when I say the required training. Here's what we're talking. Those required trainings: ISP training, abuse and neglect, positive behavior support, CPR and first aid, med aid, and then the piece for employment services and individualized skills development. So we're talking above what those initial requirements are, and those are the courses that are included in the training plan. And with that, I will pass this off so that we can learn more about reporting on remote supports.
Good morning, everybody. So with remote supports is applicable to service providers offering individualized supported living and or respite services who implemented remote supports in conjunction with these services, which resulted in a cost savings. The provider is going to complete a cost analysis utilizing a required Excel format, which I'll share with you here in a little bit, to represent the people receiving services and the savings realized. The Excel document acts as an invoice, and the provider submits the invoice through RedCap. So on the next slide, we have a copy of the spreadsheet that you'll use as an invoice, and we will send this out to providers. Everything is pre-populated in the Excel document. You'll see that there is a tab for every month, and that it creates an invoice, a summary at the end for you. So you will be entering the information that is shaded in gray, and then the document will auto-populate the columns reflected in white. You might notice a little change in here where over to the right, the second from the end, the percent of value-based payment. You might notice that that's a little different than the last time that we presented this information. Previously, we were representing this as 15% of the state share because that's what we were going on and had budget allocation for. And we did not know at the time whether CMS was going to approve this value-based payment, which is a cost savings and different from the other value-based payments, to be funneled through the waiver. And subsequently, happy news, we did get approved by CMS through the Medicaid waiver, which means now it is 15% of the total savings that providers will be getting back. So that is happy news, an exciting change, and one I think we were all hoping for. So the spreadsheet has been updated to reflect that it is 15% of the total savings, including the federal funding. On the next slide, you'll see a copy of the summary that it auto sums for you based on the data that you provided in each of the months in the Excel spreadsheet in prior months. We're electing to use an Excel spreadsheet for your invoice instead of having you manually update RedCap with all of this data. as the spreadsheet allows you to track your information on a month-to-month basis instead of having to try to compile it all right before you put information into REDCap. So it can help you prepare along the way a little bit better and provide you with a document that's standardized. In exchange, we'll be able to use the Excel spreadsheet in REDCap and export all of that data and analyze it from the Excel spreadsheet. So it'd be really nifty to be able to see the across the board savings out of this value-based payment, as well as per individual, per provider. We'll be able to collect and share all of that information. So on the next slide, you'll see the REDCap screen. Similar to everyone else's, it gives you a little summary of the value-based payment that you're reporting on. It is very simple because you're just going to be documenting here the service you're invoicing, the fiscal year, the time frame, and the specific months. And you might say, well, Wanda, I entered the time frame invoice. Why do you want me to enter the specific month? And the reason is you might not have a savings every one of those 6 months. Maybe you didn't implement remote supports until October. So you would select October, November, December. And then we all know things happen, and there might have been a temporary health need that the person needed more staffing. So there might have been 1 month out of all of these months where there was not a savings. And then a little bit of data, number of individuals invoiced, number of rested individuals invoiced, and then you'll upload the spreadsheet, and it will verify that you've uploaded the spreadsheet in order to complete your value-based payment actions in REDCap. On the next slide, we've copied and pasted the contract language you'll see. It is very reflective of the language that's already been shared with you in previous trainings and in this training. It is basically putting into contract how the savings will be derived and what the expectations are around that. So it outlines that it's biannual payments in January and July for the previous 6 months, and that it references the performance standards presented in the table below. And so if you go to the next slide, you'll see that it is a reflection of the breakdown of the savings that the spreadsheet is going to help you realize. And you'll see over in that right column, the payment is 15% of the savings, period. So happy news, excited to be able to share that. Hopefully you'll find that the contract language it meets every expectation of every webinar we've had this far, and that we're just recycling that information into the contract to ensure that everyone understands the expectations and the parameters of the value-based payment. And with that, we have reached our break point. So Emily, how much of a break do we get?
I'm going to say 5 minutes and we'll be back.
All right, thank you, everybody. We'll see you in a bit.
Thanks. We will finish up our presentation today with tiered supports and employment reporting, and then a wrap up. So I'm going to hand it over to Kathleen Deppler for tiered supports reporting.
Hi. So for tiered supports reporting, we have an opportunity for ISL providers to earn a payment for providing us data. And that looks like on a yearly basis, providing things around your policies and procedures, things that don't change very often. Quarterly, providing reports based on the data that you've been collecting and those reports that you're utilizing in your decision making. And then monthly, providing the data around your implementation practices. And we have specific data points that you'll see on some upcoming slides here. You're going to use REDCap to report all of this. And this is one of the ones that Emily was mentioning that's much more comprehensive and complicated. So my very last slide today will be an invitation for you to register for a specific training all about how to enter all of these components here. So just as a recap, again, this is available for ISL providers, and you will be able to earn payments for submitting 100% of the data elements that we're asking for. And it is an option in those elements to say that we're not currently collecting this. So if you don't have the data around a specific component, the option is there to tell us that that's not something that you're currently collecting. Available for this reporting is a payment of $174 a month, which will be provided on a paid on a quarterly basis for the months that you've submitted by the 15th. Here's an example of the form, and again, the forms for this specific opportunity are much more complicated than the others, and we'll have a specific training about how to enter these. The language around our provider contract, I kind of already mentioned most of the highlights here. $174 a month for paying for reporting, and that will be paid on a quarterly basis for the months where you earned, and as long as the data is entered by the 15th. And again, if you're not currently collecting one of the data points that we're asking for, simply telling us that you're not collecting that still allows you to qualify for these incentives. And so in addition to the pay for reporting that you would do on a monthly basis, we will look at all of the data and materials that you submitted through the pay for reporting, and we will use that to identify your level of implementation. There's a tool that we have to do this, and you would be able to know going into this how you will be assessed on this form. We have all of it outlined for you. And again, I have a link, and I can actually put this in the chat box for you. It's also available on the value-based purchasing website. So there's the assessment. We want you to know going into it. We want you to assess yourself and be prepared for what your outcome will be. And you'll use REDCap again to submit all of that documentation. So for the level of implementation payment, there are multiple payments available depending on your level of implementation. And so for a high implementing agency, you're looking at being paid $15,000 per quarter for when you are implementing at that level. And again, you can use that self-assessment that I put in the chat box to identify what your level of implementation is. For a moderate implementing agency, the payment available is $10,500, again, paid quarterly for each quarter that you earn that level of implementation. And for a low implementing agency, there's a payment of $6,000 available for that quarter for your implementation assessment. And again, if you're not implementing a certain portion, you can say, I'm not doing that, and still have the opportunity to earn. We want to know what people are implementing successfully. So here's an excerpt from that tool that I put the link in the chat box for. It identifies what you'll see on the REDCap form, the question. It identifies here's what you'll upload to show the proof of that, the evidence of your implementation. And then you can also see the questions that the assessor will answer. So that's what you can look at to say, how would I answer this question? Am I going to earn this available point? And based on the number of points that you earn, that's how you will identify your level of implementation. So in the contract, the language identifies those the payments that we went over. Additionally, in the contract, it outlines the assessment, which is several pages long and is not screenshotted here for you. But in that document in the chat box. So it reiterates again the $15,000, $10,500, and $6,000 payments that are available based on your level of implementation. And it also provides a table that shows each of the components, just like the form that I put in the chat box for you. And here is the opportunity that I mentioned earlier for a detailed how to enter, how to upload the documents. This training, we will provide a detailed opportunity of how to enter all of the various components for the yearly, quarterly, and monthly requirements for the pay for reporting, and the level of implementation. So you can take your phone camera and scan this and register to attend this additional opportunity to take an in-depth look. And I believe I will pass it off to my employment colleague.
Kathleen. So with the employment reporting, this will be a fairly quick, high-level overview, as there is a more detailed webinar scheduled for tomorrow, and information about that webinar I know was sent out today through the division's email blast. It was sent out at the end of December, and we will have the link here in a few slides. So again, the employment reporting is a little bit more detailed, similar to the tiered supports, and that RedCap is serving as the site to do all of the data collection. The value-based payment, pay for reporting on employment reporting, is eligible only to those employment service contractors who are delivering career planning, job development, benefits planning, pre-vocational, or supported employment services. So with the next slide, similar to the other initiatives that we've talked about, this would be kind of the home page when you get into the employment reporting. Here, what you can see is a little bit different than some of the other screens, is it does ask for information about the individual themselves, their DMHID, and then list each of the employment services. So as we go to the next slide, when it comes to the provider information, again, very similar information as what you've seen in the other incentives, where you list the provider name, the 85 number, and the contact information of the person who's entering the information. As we go to the next slide, this is where you'll see information specific to the individual who is receiving the services that the provider will be reporting on. So here, the individual's DMHID, as well as their first name and last name, is entered. And as we go to the next slide, back to the kind of primary dashboard within the provider agency, you now will have a screen that will have the individual's name, DMHID on the left, as well as each of the reporting periods, which a report could be completed, and then each of the potential services that a report might be completed if the individual is receiving that service. So on the next slide, if the individual was receiving benefits planning, on a screenshot here is some of the basic information that would be getting collected. Again, we will have a more detailed webinar tomorrow on the content, because depending upon how you answer these questions, there will be additional screens. So that more detailed review will occur in tomorrow's webinar. So as we move on to the next screen, this would be what career planning looks like if the individual was receiving career planning during the quarter in which you're reporting. Again, they don't have to have completed it. It's just that the individual had billable activity. And in that circumstance, again, there would be reporting that could be completed for career planning. And this is an example of the type of data that would be collected. Moving to the next screen, very similar type of screen. This is information for job development that would be completed for the individual who may have received job development services and had billable activity by the provider agency. As we move to the next screen, we will see information about pre-vocational services that would be completed. Again, one of the first questions is whether or not the individuals actually completed the service or not, as that is going to trigger additional questions. And as we go to the next screen, is the last of the employment services, supported employment. And again, here, basic information about whether the person's completed it or not, whether or not they're still employed, and then it gets into the more detailed information that we'll review in tomorrow's webinar. So as we go to the next page, the provider contract language has been updated to reflect the approval of this in our waiver application. Again, this is a value-based payment that is eligible for all employment contracted service providers. It is paying $55 per report for each individual for each service they're receiving. So as an example, if a person had billable activity in career planning as well as benefits planning, there would be a $55 report for each of those procedure codes if the provider chose to complete the report for each of those services. And as we go to the next slide, the more detailed overview of this, where we walk through and do a live demo of each of the reporting metrics or reporting platforms in REDCap is tomorrow, and then a repeated session will occur on January 12th. And I will put that registration link in the chat box. And with that, I will turn it over to Emily.
Thanks, Dwayne. So that concludes the portion of our webinar over each of the incentives and how you will be using REDCap to enter your request for the incentive, your attestation, and your data collected for the incentive. Next, we're going to talk about the data collection entry timeline. So REDCap is opening on January 17th, Tuesday, January 17th, and you'll be able to, at that time, request user access. And once you've received been granted your user access, you can start entering incentive data into the portal. The portal will be open for approximately 45 days. And I say approximately because this is our first time doing this, and we are aware that we're new to this. Our providers are going to be new to this, so we were putting the 45-day time frame in there, hopeful that that will be enough time for everybody the first time doing this, to get all that data entered. For future periods after our initial opening, our incentives will open the incentive time period. So as you notice, there are several time periods listed in REDCap for incentives. Each incentive will be open at specific times. So your next incentive period that you're eligible to enter data for, it will open the day after the reporting period closes. And then the incentive reporting period will close the 15th after the second month, or the 15th after the month, if it's a monthly report. And I know that's confusing when I say that. So I tried to give an example here. If our period is January 1st through January 30th, meaning it's a monthly incentive, the portal will open on February 1st, the first day after the period closes, and it will close on the 15th of February. So you have those 15 days. And that one is specific to, I believe, the only one we have is the tiered supports, which is the monthly one. And then if you have a quarterly incentive that you're entering data on, for example, January 1st through March 30th is the time period, the portal will open on April 1st and close 2 months after on that 15th. So it would close on June 15th. I think, yes. Yeah. And then the next period would be January, if you have a 6-month period, January 1st through June 30th, it opens on July 1st, the first day after, and it will close on August 15th. And then kind of the last step of the process is the incentive record closing, or that period that you've entered data in. It will close, the system will lock the record so that no additional changes or entries will be accepted. So that will be like after the 15th of the month, that period will close the record, and no further information can be added. So there's our time frame for entering our data. And then lastly, bringing us back to the provider contracts. Contracts will be distributed with the draft language after the webinars to allow for comment. And those comments will be accepted through this webinar if you have comments while we are going through the webinar or questions. And then also the division mailbox at ddmail@dmh.mo.gov with subject line VBP provider contract. With the contracts, the provider contracts for the incentives, the contracts will be required to be returned and signed returned to the department and deemed effective before the division can make any payments for the incentives. So these REDCap will open to enter your data. However, incentive cannot be paid until the contract is signed, returned to the department and deemed effective. It's just a reminder on that. And that takes us to our resources, kind of wrapping up today's webinar with our resources. Today we talked a lot about each of the incentives and the data collection. The primary goal for today was really the provider contract review and data collection, but this webinar may have led to questions that you have about our incentives. Our value-based payment website is available to all our providers, and I have the web address on this slide here. It's a great reference or great tool with lots of resources on it. A couple that I wanted to mention, I did not put this on here, but each of our incentives have a one-page document that is available for each of our incentives to kind of go over the details of each incentive. We also have an incentive table that is very helpful to see all of our incentives in one spot, essentially, and all the important key information. Details about each one. For instance, when does it start? Is it quarterly, monthly? What is the payment measure? What is the metric used to determine if you've determined to have met the criteria for the incentive? And then we also have a link here to incentive questions and responses. So these are questions and responses that we've received in the past on our incentives. It's really good reference to some of those questions you may have about DSP training incentives, the employment incentives, EVV, all of our incentives, they have the questions that we've received in the past are in this document. And then to reference today's webinar, we will also be putting together a document of the questions we've received from our data collection webinars. And then lastly, there's a couple resources here for REDCap, an overview of REDCap, and also data entry overview for REDCap. And any additional questions, comments, or you can send to the ddmail@dmh.mo.gov with subject line VBP data collection to this email address, to our DD division mailbox with that subject line about today's data collection webinar. So that concludes our webinar. We appreciate everybody joining us today for the training and explanation of how REDCap will work. We will, again, as I mentioned earlier, we will be having an additional, it'll be the same content, but an additional one if you want to listen in again, and that will be next week on the 10th. And we thank you for your time today. Thank you.